Good evening, class. My name is John DeCossin, and for my persuasive speech today, I will be talking on the importance why everyone should learn CPR. I've been in active practicing LVN in the medical field for about 14 years now. I've worked in a multitude of settings, acute care, skilled nursing facilities, and now actively work in home health, so I'm out in the community taking care of patients in their home. CPR is a very important skill to have because it keeps you readily equipped to be able to address certain situations in a time of need. And one of those times of need that I'm talking about is called cardiac arrest. Cardiac arrest, per CPR.org, is the action of the heart stopping its mechanism, which is to stop pumping. Freshly oxygenated blood is very important for all the vital organs and tissues, including the brain. Without that, we cease to function. That being said, how does cardiac arrest happen? Well, cardiac arrest can happen from a number of situations, including car accidents, bodily collisions through sports activities, and also from sudden drownings. Cardiac arrest can happen to anybody as young as 5 years of age, all the way up to as old as 80 years of age. Also keep in mind that sudden cardiac arrest can happen from elderly age as well. That being said, here's a couple of facts. Per CPR.org, more than 350,000 cardiac arrests happen outside of the hospital setting yearly. Okay, so you never know who you can run into where this can possibly happen. And yearly alone, totaling all cardiac arrests, you can have up to 475,000 cardiac arrests. That totals more than flu, cancer, motor vehicular accidents, and house fires combined in terms of death. So what's the answer to a cardiac arrest? Well, it's CPR. Are you ready to handle CPR is the question. Most people that have been surveyed through CPR.org state that less than 20% of Americans actually feel readily equipped to take on CPR when an actual emergency situation happens. It's a very stressful time, and when you are not drilling a certain skill, you will then go blank. I've seen it happen before many times with newer clinicians. CPR is a very easy skill to learn. It helps increase the odds of survival for the victim who's having that cardiac arrest. And like I said, there's many certifiable centers you can go to that are accredited by AHA and the Red Cross. So CPR is basically you manually manipulating the heart to pump fresh oxygenated blood through all the tissues. Like I said, it's very easy to learn. That leads to the question now then, well, if it's that easy to learn, do I really need to learn it? Can't I just call 911 and wait for emergency medical services to arrive to help the victim that has fallen to a cardiac arrest? Yes, you can, but also keep in mind that the average emergency medical response is anywhere from 8 to 10 minutes nationally. By the time that you recognize that somebody's had a cardiac arrest, we don't know when it happened, to giving your report to emergency medical services and them coming and starting their assessment and then taking action, that could be anywhere from 8 minutes to 25 minutes. It's shown statistically that once the heart has stopped, every minute that passes, there's a 7% decreased chance of survival and decline in brain tissues. Certified brain death actually happens anywhere from 7 to 8 minutes. So that's why it's imperative to know CPR, especially once you've seen somebody experiencing a cardiac arrest. So let's say you do the CPR, you save this person's life. The next question you get worried about is, well, what if I get sued? Well, under California Health Safety and Code section 1799.102, also known as the Good Samaritan Law, no person who in good faith and not for compensation renders emergency medical or non-medical care at the scene of an emergency shall not be liable for any civil damages resulting from any act or omission. So this is basically saying that you're covered by the Good Samaritan laws when you act upon a situation in good faith. So in summary, CPR is very important to learn. There's many accredited centers that you can go to, including the Red Cross and American Health Association. It's a very good skill to have. You never know who's really going to need it. It's not something that we expect to happen. We just know that the statistics show that cardiac arrests do happen. Take responsibility and get certified as soon as you can.